So the basic components of the office setup would be the front desk. You probably, if you are in practice, you probably have a front desk person, but your front desk person needs to be educated about hair when they're answering the phone. There's questions that people are going to ask before they even come to, or they book the consultation. So educate your staff, but not to say too much, because you don't want them to go into details and not only waste time, but mislead the patient, because that's not in their responsibility. However, educate your people to know why you're different and what is that you do. Other components that you need to have would be consultation room, photo room, or if you don't have a photo room, you can have a designated corner that you can take consistent photography. It is important. Subtleties in hair growth are the best shown with consistent photos. So make sure that you have a good place where you're taking photos in consistent way. And then you can have storage room, cleaning room. Those are the things that they are common to every office. So then you need a operating room. So your surgery room can be something you use for another procedure, or you can set up specific room for the hair transplant. What is specific about this room? Most likely are the cutting areas where the assistants are going to dissect graft or inspect the grafts, depending whether you're doing FUT or FUE procedure. And then we're going to go into specifics of each component of your surgery room. So what is so specific about chair? You need a chair that has a narrow back. When we're placing grafts, we come close, so there will be a patient's head and two assistants working in a close proximity. If the back of the chair is wide, we can't reach the patient, so it's not easy to place grafts. Another thing you need is adjustable headrest, because the head has to be positioned in a certain ways that we can access the crown. So that is very important. The patient has to be comfortable for many hours, but at the same time, the ability to move the head in a different positions is very important for graft placement. Adjusting chair up and down. Sometimes you want to consider the footrest being adjustable, and so the main thing about the chair to remember is that it has to have a narrow back. Another thing, if you're doing FUE procedure, you may want to consider a chair that are versatile, where it can flip, and when your patient is in a prone position, the arm rest is already on the chair. Otherwise, if you're using this chair, the armrest doesn't flip, so you have to figure out what your patient is going to do for your time of harvesting time, because not many people can lie down like this for many hours and having shoulders back. So the arms go underneath, and you have to figure out what to do with the arms underneath the chair. Lights are very important. The overhead light has to be cool light, not to create a shadow, and so it has to be nicely diffused. And also you need two light sources. If we're placing hairs in a temple, or patient's head is curved, one light source will not be able to shine evenly everywhere, or the one light source cannot shine in two areas, depending how we are working. So if you're setting up your office, you want to plan for the second light. So in the beginning, you may be able to have overhead light in the light that it's on a floor stand. So you may be able to add that, maybe a less expensive option, but keep in mind that you need two lights. Then workstations. So you can have one table, like here. We build this table. Someone built the table for us. You can have individual tables. You can buy them like a little desk tables. What you're looking for is about 2 to 3 feet, not less than 2 feet. 3 feet is sufficient, because your microscopes are sitting on a table. Then you need space behind to put some instruments, extra supply, but you don't want to take too much space with a table. We have a folding table, so, we have this folding table. I saw at IKEA you can buy a folding table, inexpensive, and so with a tabletop microscope you can transform any room into hair room if you have enough walls to build these folding tables. So you can design your office the way, or your office practice the way you want, as long as you know what is important. Microscopes are very important. There are many different types of microscopes. What you need to know is you need a stereo microscope. And you have a certain working distance, that is, it has to allow for the instruments to be to fit in hands underneath the microscope. In our office, I like this microscope. It does not have adjustable magnification, but it has fixed lenses. However, it allows me to look straight, and I don't have to focus on my eyepieces, because it gives me one view. It looks almost like I'm looking at a TV or a monitor. There are microscopes where you can have a camera attached to above the lens, and it's projected on a screen. So there are many different types of microscopes that you can get. The vendors upstairs will guide you through the process. If you go to the meetings, you're going to see vendors. If you go to the ISHRS meeting, they're going to have vendors there. Most common are Miji, or not most, one of the brands are Miji. We have both in our office. We have assistants who like one or the other. It's up to your assistants and you to see which one are more comfortable, and the prices vary. But you can have as inexpensive as $800 for a microscope, but it's important to have a microscope in your office. Then you need chairs. You probably have these in the office, but some are better suited. For example, the dental stool is well suited, because not only that they can get the back support, even for you can use that when you're doing FE, sometimes to rest your arms. The other thing, the assistants where they're placing, let's say third person, can have this bar in the front and place and rest the hands. So it could be a versatile stool. So that's one of the stools I like. Magnification, when we're placing grafts, we use magnifications. There's inexpensive magnifiers upstairs that they come like a little band with a visor that comes down. They're $29. They're the least expensive. But any type of magnification is better than none, and we always say when you're placing grafts, you have to have magnification. You cannot use these magnification to replace the microscope. So I want to make sure that I communicate that with you. And then you may use a more sophisticated magnification in loupes for FUE, because the better you see, the more precise you are, and the less fatigue on your eyes. Instruments, you may have some instruments. Let's say if you're starting strip surgery, mostly strip, you may have some instruments in your office. Some you may need to purchase. For example, there are specific instruments we use for graft placement, graft dissection. So vendors upstairs, and I always say vendors because they are specialized in hair restoration. So they have been with this industry for 30 and more years. They are here for a long time to stay with you and serve you, so you can trust them. They won't misguide you because they want you to come back and order more. It's like a hair transplant. Your patients come back to you. Other procedures, they may do once nose transplant, nose reconstruction, and they don't come back. It's done. In hair restoration, they keep coming back. The same thing with our vendors. They want you to come back to them. And they both provide some same and some different things within the instruments and equipment we need. So we're going to visit both, and then you're going to be able to make judgment which one to use. Sometimes we order some things from one vendor and some from another, but I want you to know that they're really good and they're going to help you and guide you. If you're doing FE procedure, you can have the the motorized piece that costs maybe within $1,000 or $500,000. So it depends what your $250,000. I don't even know how much it is.
Once you spend a quarter, you
something.
might as well spend a half.
The big stuff. So my point is that you can go as low as $12,000, $10,000 to equip your office, or you can go as high as you want. And before I go any further, so I just want to tell you this, there are they have catalogs upstairs. We're going to go upstairs, make sure you have to grab both from both vendors. One of the vendors prepare little startup suggestions with pictures, so it gives you an idea of what the instrument looks like, what the ordering number is. So that would be a good, helpful tools to have. And then regarding the assistants in training, the questions always come: how many assistants do I need? How do I train them? Do I hire the assistants? And so what I believe is that if you have someone in your office that you cross-train is the best, because if you have someone you work with well, and you can train your assistant. These courses, this course, there's a course in Denver, there's a course in ISHRS, but this course and a Denver course, and there's a one in England, spend a lot of time training surgical assistants. It's a lot of hands-on, so a good foundation of the skills in assisting hair restoration is done in these courses. And then minimum 3 assistants. You can function with 2 assistants, but I would say in order to grow in kind of plan, if you want a well-running office, minimum 3 assistants to have all that you need and keep not being totally trapped with doing procedures in long hours. The other question is, do I train, do I hire? So, in one thing I forgot to tell you, if you're cross-training your assistants, then if everybody knows what has to be done, if someone is sick or something is more, or let's say tissue is more difficult to sliver, another one can step in. So you're not dependent on one person being specified in one task. If that person doesn't show, then you have a problem. The training and hiring is a similar situation. If you totally depend on people who are trained, they come to your office, first you don't know their quality or quality work, and the second thing is you're not, what if they don't show up, so you won't be able to perform your case. The good side about having someone who is well trained come to your office is they're already proficient, so you can accelerate your learning curve by having someone behind who knows what to do and kind of support your learning. So I don't know anyone to recommend, so that's the sad part, because I can't vouch for their work. I have never seen their work. However, I know that they're good surgical assistants who provide service and travel, and so maybe if you're a member of ISHRS, you can network, ask people who is hiring traveling assistants, and find someone with a recommendation, and then maybe you can have 1 or 2 assistants that come from the outside, and then you have intern one of yours train and start being more proficient, then kind of slowly transition out until you get your own staff totally trained. And teamwork is very important. You need to know what entire team is doing, because if you you need to have a constant feedback from your assistants. If they're doing good work and they support your work, then everything works well. So a team of assistants is essential.